Hello and welcome to Baby Help. I'm Dr. Sandip Gupta, Senior Pediatrician and Childcare Expert. So today I'm going to answer questions regarding newborn screening test and what is newborn screening and what is heel prick test, how we do and why we do this. So let's start. So I am going to tell you about newborn screening test. So newborn screening is done to detect diseases which may be there in children before the disease actually show any symptoms or signs. So screening essentially means identifying a disease before it actually becomes manifested. So what we do is, we have seen in India about 4 to 5 out of 1,000 children may have certain diseases at birth which may not be identified by just looking at the child. And later on it may manifest with severe problems like problems in the development, in the brain, functioning of the brain, or overall growth and development of the child. And these are all related to the metabolism of the certain protein, sugar or carbohydrates and fat which we take. So for this we do this testing. Apart from that, there are some endocrinal problems also which can actually be there and not seen at the time of birth, but which can cause later serious problems in children. So that's why we do newborn screening tests. So another newborn screening test is for eyes and hearing, because vision and hearing is a very essential function and it develops very fast and very like steep curve of development happens during the early part of life. And if we miss somehow to identify problems in vision and hearing in early life, then it can become a later on major problem for the child. So let us start by saying one of the most important newborn screening tests is the hearing test. So many children who are actually having hearing problem cannot be identified at the birth, and because usually children develop a response to sound by 3 months or 6 months. 3 to 6 months the response to sound develops. So before that we don't have any clue whether the baby is able to hear the noises in the surroundings. But the problem with the newborn hearing is, if you do interventions after 6 months, the results of the interventions will not be appropriate or will not be able to compensate for whatever development has been lacking in first 6 months of life. So that's why ideally any hearing defect should be identified before 3 months and the interventions should be started at least by 3 months. So that's why most of the children should undergo newborn hearing screening at the age within 1 week, 1 to 2 weeks of birth. So we do it by Acoustic emission test, which is a test which actually detects if there is any problem with hearing. It's a screening test. It only identifies if the problem is there or not, and it is done by putting some devices in the ear and recording the noises, and it is a very low cost investigation also. So this is about hearing screening. Then if you find any screening in the screening any problem, then you do more definitive test, that is called BERA. So BERA is brainstem evoked response audiometry. So it is a definitive test to identifying hearing problems in small babies who cannot communicate. So this is done if the OA is having any issues. So these tests actually identify the hearing problems, and if you intervene early, then the hearing function can be restored and the child is likely to have a normal hearing function, which is very important. Now coming to vision screening. So vision screening, something we call is ROP screening, retinopathy of prematurity. So prematurity means baby who was born before their date. So retinopathy of prematurity is a risk in children who are younger than 32 weeks at the time of birth. So if the child is less than 32 weeks of birth, 32 weeks of age at birth, then we do retinopathy of prematurity testing. What happens is, there is a disease called retinopathy of prematurity which happens in preterm babies, especially if they require ventilation or oxygen support at the time of birth. Why this happens is because the premature baby has a very undeveloped lung, and lung is not fully developed, so it can have disease called respiratory distress syndrome, wherein we give oxygen. So to respond to oxygen, actually retina develops some abnormality in their vessels, so which can cause further problems in the future vision development and can even lead to blindness. So that's why we need to identify it early, and it is treatable by laser therapy. So mostly it is done for less than 32 weeks child. If your child is term, then mostly it is not required to be done. Now coming to the blood tests for newborn screens, one of the most important newborn screening tests is congenital hypothyroidism. So first of all, I'll tell that blood screening tests for newborns are done by heel prick. So you need not worry that a lot of blood will be taken, a child will have too much pain. Only a small amount of drops will be taken of the blood sample will be taken, and it will be done on a filter paper. So it is called heel prick test, and it is done on filter paper, and the technique is requires very less amount of blood, and the results are very fast, and it is not a very costly test also. For 7 diseases it may take somewhere around 2000 rupees for you. So most common and most important blood test for the newborn screening is congenital hypothyroidism. So as I told earlier also, the thyroid hormone has a very important role in brain development in early stage, especially in the first year of life. Thyroid hormones control on the brain development is a major role, and if the thyroid hormone is deficient, there is a very high chance the child may develop mental retardation in future. For this, we need to give thyroxine to babies who are having less thyroid function or congenital hypothyroidism at birth. But the problem with this is it cannot be identified by looking at the child in the initial phases of life. So first 6 months it may be difficult to identify who is having congenital hypothyroidism, who is not having. So that's why we do mandatorily for every child after 48 hours of birth a thyroid screen test by doing a TSH level. So this is one of the most important ones. Then the second most important is congenital adrenal hyperplasia. In this, what happens is certain gender controlling hormones in the adrenal gland, they are defective. So because of this there can be issues in the gender gland, gender based organ development. So that's why we do it, because the disease cannot be diagnosed at birth or even in younger ages. It can manifest later with a lot of problems in the genitalia. So we do it at birth to identify and do the proper treatment for this disease, and it is called congenital adrenal hyperplasia. Apart from that, one of the most common diseases in India is G6PD. So G6PD is an enzyme which is there in our RBCs, red blood cells, which actually if deficient makes the RBCs more prone to breaking. Or sometimes if certain food particles, food you take, or certain sulfur drugs or anti-malarial drugs you take, the blood may break, the RBC may break, and it can cause hemolysis and problems. So G6PD deficiency is quite common, and it is a disease of male babies mostly. So you may suddenly discover that your child is having a blood problem. So we diagnose it at birth by doing a screening test. Apart from that, another important test which we do at birth is cystic fibrosis test. Cystic fibrosis is a disease where our glands in the body and the lungs actually can get affected. So cystic fibrosis is another important thing which we do. Galactosemia is another common test which is done. It is the enzyme which is defective that actually helps in digesting the galactose. Galactose is a very important component of human milk. So the galactose digesting enzyme is deficient, and the galactosemia problem can happen. So that's why we detect and treat them. So apart from this, there are multiple defects are there, like biotinidase deficiency, phenylketonuria. So there are multiple panels also. We usually do 7 investigations at birth. Like I said, congenital hypothyroidism, congenital adrenal hyperplasia, G6PD, cystic fibrosis, galactosemia, biotinidase, and phenylketonuria. So these are all the common ones. But in Western countries, they have a newborn screening panel where they may include even 30 to 40 diseases to rule out all the common diseases which can actually affect the child's growth, development, and other issues. So that is a more comprehensive panel that is available in India also, but it is slightly costlier than the general panel. It may cost you around 5 to 10,000 rupees, whereas the 7 investigation panel comes around 1.5 thousand to 2,000 rupees. So overall, I would recommend all of you to do newborn screening test for your child. It is very important. It may prevent certain amount of diseases and problems in your child, and later morbidity and brain development issues. So this is very important. I would recommend all of you to do it. It is nowadays done in most of the corporate and private hospitals to prevent these kind of disabilities and developmental issues later in the children. Even in government setup, the option is available, but in smaller districts and rural areas, this is the awareness about the inborn error of metabolism and newborn screening is not available. So I would recommend that you, even if you are there, you can ask your pediatrician or neonatologist that whether it is available and can be done. Thank you for listening to our video. If you like this video, please subscribe our channel.